Hello everyone, on behalf of Moja Ramesh Amiti's Health Tourism Company. As you remember, in our last video, we briefly introduced abdominoplasty procedure, or commonly referred to as the tummy tuck surgery. Today I'm going to briefly review the post-operative instructions to you, which is very important for the recovery from this surgery. This surgery, as we talked about it, is done under general anesthesia, and then you are recommended to stay at the hospital for 1 to 2 nights after the surgery, to be under the supervision of your surgeon and the hospital staff to monitor your condition. The almost full recovery from this surgery is about 6 weeks, by your doctor you will be prescribed antibiotics and pain medications to take regularly as instructed by your surgeon. You need to avoid medications containing aspirin or blood thinning elements, as they may increase bleeding and interfere with the recovery process. It is very important not to take alcohol or nicotine of any kind, or if you're a smoker, as they considerably interfere with your healing process. For the next 6 weeks, you will be instructed to wear an abdominal binder or a compression garment to support your abdomen and avoid fluid buildup and swelling for 6 weeks. After the surgery, you need to maintain a healthy diet and drink considerable amounts of water and fluids to flush your body of the toxins and to minimize swelling. You need to eat fresh fruits and vegetables, and for the first few days you need to maintain a liquid and light soup diet, and then gradually go back to your normal diet. After this surgery, because of the medications, you may experience constipation, for which again your doctor will prescribe you medications or a specific diet. As for the activity after the surgery, it is very important that you remain flexed at the hips to relieve any tension on the abdominal muscles and the incisions for the first few days. This includes when sitting or when walking or during any activity. You need to have your hips flexed, or for the first few days, walk with a hunched back and hunched over to avoid any extra tension on the incisions and the operated part. What is very important is that after the surgery you need to immediately have a regular activity, even if it's a light walk. It is very important to prevent formation of blood clots, which is a very serious side effect if not attended to carefully. But for 6 weeks, you need to avoid any strenuous activity or sports, or even lifting weights over 10 pounds. to prevent any pressure on the operated area, which is your abdomen and your incisions. As we talked about it in our last video, there will be inserted a drainage tube in your abdomen to for the excess fluids and blood to exit your body to prevent swelling and other complications. This drainage tube needs to be on you as long as your surgeon recommends you to. They usually ask you to report the daily output to your output of the fluids to your surgeon, so he will know when is the best time to remove these drains. So it depends on your recovery process. As for bathing, you need to avoid full bathing for the first few days, as long as the drains are on your body and your incisions are fresh. Maybe a light shower or a sponge bath is recommended after the surgery, after 2 or 3 days after the surgery. And you must not remove the compression garment from your body, maybe during the bath especially. And during bathing and taking a shower, you need to be careful that the drains are not hanging. These are and the full recovery is usually reached after 6 weeks. And then you can go back to your normal activity, your normal work. And during this process, you need to be careful not to impose any pressure, abrasion, or tension on the incisions and the operated area, as we talked about it. If you experience any abnormal condition like shortness of breath, chest pain, swelling of your legs, which seem abnormal, you need to consult your surgeon. This can be very serious if not attended to. Swelling, redness, and bruising of the area is normal, which will go away after a few weeks. And numbness of the skin of the abdomen is also normal, but it can take months to go away. So you need not to worry about that. These are the basic instructions for abdominoplasty home care. If you have any questions regarding this procedure, the instructions, or our packages that we offer to foreign patients in Iran, please feel free to contact us at any medium, WhatsApp, website, our website, ametistmedtour.com, Instagram, Facebook, etc. And we will get back to you as soon as possible. Thank you for your time and have a good day.